my name's Elise Pert. I am the Health Science 1 instructor as well as the Allied Health instructor. I teach a lot of different clinical skills in Health Science 1. The students learn how to move patients, make occupied beds, nail care, how to do vital signs, so take a blood pressure, pulse, and respirations. And then also after that, they have the option of whether they would like to take the LNA program for their second year or if they'd like to go into Allied Health. So Allied Health is the second year program that I teach. We learn a lot of different things in Allied Health. Allied Health is for students who don't fit the typical LNA or registered nurse mold. So it's a little bit different as far as what we learn. The content is pretty broad. It can be anywhere from regular clinical skills like vital signs and grooming a patient to dental care if somebody is interested in being an orthodontist, or also veterinarians or vet techs. So Allied Health is a great option if you have an idea that you want to be in the medical field, but you're not exactly sure where you would like to be at this point. That's fine. It kind of helps to narrow that down a little bit. We do different things such as sterile fields and suturing. We draw blood from a fake arm. We do EKGs, so we're checking heart function on patients. We move patients with wheelchairs. We work on the skills that we also had developed last year, so the vital signs and moving patients in bed and moving them from a bed to a wheelchair. All of those things we touch base on again. We also expand on things. So for instance, we work with a Snellen eye chart to check somebody's vision in the first year, and then we kind of expanded on that a little bit more in the second year and talk a little bit about the function of the eye, so the anatomy of the eye, the physiology of the eye, and we get into a little bit deeper than we normally would with Health Science 1 students. We get into medical terminology a lot more in Health Science 2. So the Allied Health program, whether it's LNA or Allied Health. We are utilizing Google Classroom this year. So for your student, or if you are the student, you should have access to Google Classroom. If you do not, please feel free to reach out to me. My email address is on the front page of the syllabus that was sent home and signed by parent or guardian as well as students. We also utilize AES education, which is essentially where our book is coming from. We don't have a book that will be in hand so much. We use one a little bit, but that's only in class. It's not one that needs to come home. AES education has everything that we would need for the most part to dive a little bit deeper into some of these theory subjects. The clinical skills will pull a little bit from here and there and cater a bit to the students that we have in the class. So for instance, if we have somebody who's interested in radiology, we would dive a bit deeper into that. So if you have any questions or you need to reach out, please don't hesitate to. Again, my name and email address are on the front of the syllabus. And you can call the Hewitt line, the Hewitt number, and my extension is 5018. And if you have any questions, just let me know. I hope everyone has a great day. Thank you.